Hello, everybody. My name is Kyle Kusnose. I'm the director of the Jones Institute and Fascial Counterstrain instructor, and I'm here with Greg Zadow, another Fascial Counterstrain instructor. He teaches our LV1 and LV2 classes, which are courses that we've designed within the curriculum to really be the ideal second and third course. And Greg, I'm going to get right to uh, the topic of discussion today, and what I think a problem is that we as an institute and as a Counterstrain group are trying to overcome, and that's that our students go through the Fascial Counterstrains Foundations course, and they drink water from a fire hose. Um, I always say that course is it's not a beginner's course. It's an entry level course into this world of fascial counterstrain, but it's really not a beginner's course. And they come away from that course feeling overwhelmed. They're amazed, like, wow, this seems like some really cool stuff, but I don't even know where to start. I don't know how to start clinically applying this technique. Um, so if you could share for us to start out, kind of what your experience was uh, learning this technique for the first time and getting your feet wet.
Yeah, I think that's a really common thing for new students to go through. And uh, in some ways, I was lucky in that I was introduced to the fascial work kind of as Brian was introducing the work to everybody. So it was kind of laid out at a pace of a class a year. But even with that, and I think I see this with students all the time too, you leave the class and your mind is swimming. There's a lot of information to take in, and you get to your first patient on Monday, and you're like, I know I had something in my brain that was going to work and help with this patient. So I hear about that, and I have students, or I shouldn't say students, but therapists in my office that have gone through the classes also, and so I kind of get a lot of feedback from them as well. And my advice typically is to take bite-sized chunks of the work so that you can figure out sections of the work and imply that when an appropriate patient comes through and get comfortable using it, and then be able to then move on to another section once you feel like you've handled one section of the body or one technique, then move on to the next and just take those bite-sized chunks.
Yeah. I
Yeah.
had a similar, probably a similar upbringing to you. I started in 2013, 14, and I think Brian maybe had four or so classes out at that time. So I caught up really quick. And then we were able to sort of digest this like 1 year at a time as we stacked courses over the last X amount of years. But even then with my background and history with the technique, I remember for the first at least couple years of applying this technique, sitting there at the head of the table, patient supine, and I'm at their head going through some of the scan, and my mind, as you put, it was just swimming. I like all these techniques and tender points are bouncing around in my head, and these are not complex patients either. They're low back pain patients, but
Yeah.
I overwhelmed by the
Paralysis by analysis.
yeah, yeah,
Yeah.
in a lot of ways. And so um it's a real problem. And I think for the students that are experiencing that, I think it's important for them to know that they're not special. And I
Right.
sort of
Right.
say that for effect, but like you're not alone in feeling this overwhelm. So I want to
It
talk about,
doesn't. I don't think it goes away either. I mean, I don't know about you, but I did CSS1 or CSS2. Oh, that came back again. It's like, holy smokes! I, I'm overwhelmed that next week, and it takes me months for me to digest it and start to apply it and start to feel like I get a handle on it.
to integrate.
Yeah.
Right. Right. So over the last few years, and you've sort of been at the forefront of this, given the courses that you teach, we've started to design the curriculum in ways to really ease people into the curriculum more and more. So again, the ideal course for for a student, the ideal second course for a student is LV1. Talk about LV1 and sort of what makes it that sort of ideal second course.
Sure. Yeah. I mean, it's been such a nice change. I mean, the first big change we did is we split the original LV class into two.
Yeah.
And what that gave us, first and foremost, is a pace that is much more conducive to spending some time with your instructor, with your TAs. So going over the fundamentals and getting confident and repeatable, addressing your patients in ways that you can, get that technique down or get that flow down so that you're ready to do that immediately when you get back with your patients. So that's the big start. We do go over a little bit of the rationale again, kind of do it at a little slower, a little easier, digestible pace. And then as we go into your techniques, what I think is amazing about the LV class and why we really push it as that second class is that, any work that you're doing currently or you're about to do in other fascial Counterstrain, but if you're doing deep tissue work, if you're dry needling, if you're doing manipulation, you are releasing toxins, you're releasing inflammation, you are creating tissue that needs to be drained. And so if you don't have the LV work, if you don't have the ability to find, diagnose, and treat those areas, your patients just don't do as well. And so I think that's a big part of it. And as you remember through the lymphatic lymphatics is a big part of that rationale of how that system works, is having a viable lymphatic-venous system to create the environment that allows the healing to occur. So that's a big part of it. I think the other amazing part is that it is such a good technique that works on such a broad bunch of patients. So, if you're seeing an athlete, if you're seeing someone with a concussion, if you're seeing post-COVID patients, like this morning, I think I had probably 4 patients that I was thinking, well, what's the common denominator between, say, a post-COVID patient? I had a mast cell patient that had a gut flare-up. I had a post-breast cancer patient with a bunch of radiculopathy pain. And then I had a runner with a stuck talus. And the one thing they had in common is that the lymphatic-venous was their primary system that needed to be treated. And so it's very diverse in what kinds of patients you can see. So I think we have a lot of patients that are seeing the traditional musculoskeletal patients. You're going to see swollen knees, bursa shoulders, stiff ankles, and it's going to be effective for those. But then you're also looking at such an amazing tool when it comes to our immune health and how that affects, like our post-COVID treatments, gut health, lung health, those kinds of things as well.
Yeah. F1's tough because it's a small sampling of techniques, first of all, but they're really centered to be in the thoracic spine, and Brian's done that for impact.
Yeah.
But it does make clinical applications sometimes tricky when that ankle patient comes in or that knee patient comes in. Some of the techniques from that class are certainly applicable to that patient, but it's not as obvious as, well, their knee hurts, so let's drain their knee. Or
Right.
coming with plantar fasciitis, so let's go down into the lower leg and start to open up some of those veins. What are the actual techniques that you teach in the LV1 course?
Yeah, I mean, we start off with looking at a lot of the visceral lymphatics. So there's a little bit of visceral work you did in foundations, but we're going to go through from thyroid function all the way down to bladder, rectal, liver. So a lot of GI, pelvic floor health techniques are associated in the class. But then we do every bursa pretty much through the body. So we're looking through the shoulder girdle and all our LV work down through our hand. And so a lot of upper extremity symptoms. And so your throwing athletes, your racket athletes, we have techniques that will be beneficial there. And then all the way down from our hips to our toes. So it definitely has a bent towards that athlete side of things when you're looking at the extremities. And when you go to treat an athlete, that may not be primary. I mean, it may be a bony problem at their ankle, but I guarantee you, when you have those injuries with an athlete, you will be treating the lymphatic venous system at some point. Yeah, and so having that as a base, or being able to have something to address what's going on for every patient that comes in with those extremity patients, I think is really positive.
What would you say, not all techniques are created equal in their impact and their power, but not all techniques are created equal as far as, some are just easier to apply than others as well. It's like the mobile points are larger. You don't have to be quite as specific. Um, some of the techniques in F1 can be somewhat more challenging, some of the preganglionic sympathetics and things like that. Um, what's been your experience with taking students from F1 into LV1 and really working on skill development and giving them opportunities to have success with application? Because you've had your own experience as well, but I've always felt that some of the venous lymphatic glides are actually easier to apply than some of our other techniques.
Yeah, I think it expands a little bit too, in that a lot of the techniques in F1 are more of the broad strokes or the body movement types of releases. And this gets where you can get some practice putting your hand on structures and doing specific glides. And the anatomy and the ability to release those points, like you said, some of those are just really straightforward. And a lot of times I find myself when I'm teaching just repeating, like, okay, you just compress down and out. It's very
Yeah.
simple, and the
Yeah.
body responds quite quickly. And the feel of that release, because you are addressing, specifically the inflamed tissue, and a lot of those restrictions are musculoskeletal. So your hands get to feel the release, a lot sooner than some of those other deeper jointy types of dysfunctions that you might be looking at in some of the other classes.
Right.
Or
Right.
trying to find little tiny nerves and feel a nerve release. It's just not as straightforward as I think as some of the lymphatic work.
And these are directly working on the venous lymphatic system too. So even just palpating mobile points, they're kind of can be larger bounding pulses versus the subtle, deeper periosteal pulses
Yeah,
that.
exactly. I mean, that's what makes it such a nice class for beginners, to really get the fundamentals, like you said, down, and to have that instruction. And as with all our classes, we really try and have a lot of TAs there, and our TAs are so amazing and can, really do wonders in getting your confidence up. And so when you're on a point, when you've got that release, and it's going to have an effect on symptomology or function of that tissue.
So let's say you have uh, a student that comes to you after F1. They've tried to apply it for a couple of months. Um, and you ask them like, oh, when are you getting into LV1? And they're like, I just don't know if this technique is for me. I don't know if I can do it. What would you tell that student?
Yeah, I would say stick with it. It I've seen, like I said, I've seen many students go through, and I've seen also my own practitioners at my clinic. And I mean, I really find those that are able to hang in there and you know let the skill come, let the right patients come that guide you on how you need to treat, and get that confidence. And man, if you get a couple patients, one of my therapists, Jordan, has had just a couple, knocked it out of the park. A couple patients the week after classes where he was not able to help them much before, tried a new couple techniques. Patient came back singing his praises, and that's all it took. And he is off to the races, and he just can't get enough, and just really loves it. And his skill level is going up, his knowledge level is right behind. So it's and his what I see the most then is that the passion for coming to work, the passion for the excitement to see a new patient, or to see a patient that has previously been, you might have thought it was like, oh, this is going to be tough. This is, a complicated patient. Now he's like, bring it on. I'm ready. I've got some tools in my bag, and he's made a huge difference to patients that I think otherwise, wouldn't have got the care or the efficacy that he's given them.
I think as you stack those techniques and acquire those tools, it really gives you the confidence as a practitioner that, all right, I may not have seen this diagnosis before. I may not have seen this pathology before or successfully treated whatever before, but
Yeah.
at the very least, I can get the inflammation out.
Yeah, that's right. I know where that area scans, and if it scans, I know I've got something to, to provide for that patient.
And more times than not, that patient's going to come back and give you some positive feedback.
Yeah,
And
yeah.
then I think what happens is our students get motivated by progress.
Oh,
Um,
for sure. Yeah,
and,
who doesn't? I mean, that's it's addictive. You're like, I want that feeling every time. I want that. Knock it out of the park every time.
right.
Yeah. And
And good.
yeah, I mean, I think it just spurs you on to to do better every time you get the chance, and that's what makes work fun. That's what makes you want to come back.
Yeah. Yeah. I want to bring the the neuroscience into this a little bit because it's an area of passion for me. This sort of reflex, because that's really what it is, a reflex to just give up. And where that stems from, it stems from stress, right? It's like,
Yeah,
and some of that is going back to the you're not special, you're not alone. You feel alone. You feel like I'm not able to do this. I'm not doing it as successfully as some of my colleagues are. Or you heard all these amazing stories in class over how the technique works, and you're not getting those same clinical results within the first couple months of applying the technique. And then your emotional brain starts to take over. You lose that impulse control, and all of a
hmm
sudden you're in this emotional state where I can't do it anymore. Um, and and that's why it's just so important for students to get into LV1, I think, as quickly as possible, to start stacking techniques that are broadly applicable to the entire body. Because at the very least, that shoulder pain patient, you start to open up some of those shoulder veins. That knee pain patient, you start to open up some of those knee pain pains. And I think what students eventually, what they do is they sort of habituate, and they fall into places of feeling complacent. Um, and of course I'm going to say this, but I think it's so important for students to, even if they don't feel they're ready, just to get registered for that next class, because
yeah,
you need that next thing to like look forward to motivate you to keep getting better and better and better.
exactly. Yeah, that's right. As soon as you sign up, you think I better clean up on what I've already known. At
Yeah.
least go through my manual another couple of times, try and get down some of the other lymphatic work in from foundations. Yeah, no, I completely agree, and I think the class and the way I try and teach it is to realize that this is, not the. I mean, it's an unbelievably powerful technique. It's gentle, it's comfortable, it's good on my hands. Patients love it. Uh, but there's some skills. There's some skills that need to be provided, and some
Yeah.
information that needs to be given. And we try and make it a way that is very accessible, fun, and and realize that
And
everyone's in the
simpler.
same boat. Yeah,
Yeah. Yeah.
yeah. And I really
And
think, I don't know who quoted that, but it's like comparison is the thief of joy. If you feel like you're doing okay, and then you start hearing other stories of people doing better, or some patient that got a miracle cure, and you suddenly feel like, well, I'm not getting that every time I see a patient. And I think that's, one of those things that we um, try and encourage all our students that, yeah, we have these great stories here and there, but there's patients that are still tough for everybody,
sure. Yeah.
even Brian.
Yeah, absolutely. LV1, we teach that 2 times a year.
Yeah,
Let's say patient's been through F1, they're looking at the LV1 course dates, and they're like, those just aren't going to work for me. Where do you recommend they go?
yeah. Depending on well, then LV2 obviously would be the next thing I would suggest, of course, which is a fantastic class and has a lot of those same traits, and that we're still getting into the system that is clearing out all the metabolite and inflammation that's created from dysfunction and from other techniques we're doing. But otherwise, there's definitely room to start going down some of that musculoskeletal role, or path, to do MSK1 and start doing some of the muscle chains and ligaments of the spine. It's
Mhm.
another super powerful course. It's another place where you find yourself, no matter what patient you're seeing, you're going to be dabbling in through the spinal ligaments and through muscle chains repeatedly throughout your patient load. So it's an excellent class. If you're not quite ready for the LV, or you feel like you want to just go straight for the musculoskeletal work, that's an excellent option. Also, the other option is to you know, depending on how you feel about your foundation, is to repeat the class. You can probably talk about that. I know there's discounts for repeating classes. You can do them, in Zoom with a partner on the table that you can work with at your own house. You don't have to travel if that's an issue. So I would also, encourage people to well, go back to the basics. And every class that I've done and I felt successful with is because I've done it multiple times, and that's been huge for me. And now to have the Zoom option, so I don't have to fly to classes, makes it that much easier. So I would also encourage that.
Right. The other second class, if LV1's not possible because of a scheduling conflict for that year, I also love MSKP.
Mm-hmm.
Another class that it's a lot. It's a heck of a lot more techniques than LV1. But if that pace is comfortable, then you stack a lot of techniques. But we give you in that course techniques from C1 all the way down to distal phalanx, so the fingers, down to distal phalanx of the foot, and everything in between.
Mm-hmm.
There's literally not a single patient that could come in where you're like, I don't think MSKP is going to work for this patient.
Yeah. And there's one lecture, there's one theory that it applies to every technique.
Yeah, one
Yeah.
scan. That one even one scan for the most part for
Yeah. Yeah.
you. So
Exactly. So it definitely has some yeah, some wonderful things to do students.
let's see if there's anything else that I had for you. Um, what advice, just generally, would you give new students, regardless of whether they're right after F1 or into LV1, LV2, just for newer students into their curriculum? What kind of general advice would you give them?
Yeah, my advice, and I give this, like I said, to my new therapists that are taking the classes a lot. A couple things is, you know, don't be afraid to take some time with your patient and do something new. And I think if you explain anything to your patient that you are trying, that you are thinking outside the box, you are thinking of them and specifically with this technique, that that's oftentimes more than they get from other practitioners. A lot of times I think they just feel like I just got the exact same thing I've been having for the last 2 years. He put me on the bike, he did stretch, blah, blah, blah. I
Right.
think to give yourself, allow yourself the chance to try something new, because by far and wide, patients love that. They love that you're thinking outside the box, that you're trying something new. So that would be the first thing, is just to, get your hands dirty and try and see what you find. Bring out the book if you need to and explain, hey, I just learned this. There's a lot of techniques. I haven't got it memorized yet, so I'm going to be accessing my book from here from time to time. That's a great way to start. I think also, if you look at your patient list the night before, the morning before, and just while you're, eating your Wheaties and drinking your coffee, is skim over your book a little and see, like, okay, that's right. I got to remember where those ALL ligament tender points are, and then remember that for that day. So I know I've got a patient that's probably going to have some of those. And so just 5-10 minutes of looking at your book at lunchtime or at breakfast, just to kind of get your mind thinking a little bit more along those lines, I think is super, super powerful. And then the last part is just, like you said, think ahead. Just get something on the radar. Get your next class scheduled, so you know that you've got something up. It's just like when you're an athlete, if you're just training away haphazardly, you're just not as efficient as if you've got a race on the schedule. If you've got something you're thinking like, oh boy, I need to make sure I fit for that weekend, so I need to start now. I need to get on it. And I think the same thing is, if you can just kind of book ahead and get your brain thinking, all right, I'm going to be at class. I want to make sure I'm not, the one that's forgotten everything of foundation. So kind of tune up on that, read a little ahead, and be prepared. And it'll just bring you nothing but success and joy. So I think it's a win-win.
I think you are speaking to it when you're saying don't be afraid to try something new, but it's really, being comfortable stepping outside of your comfort zone.
Yeah.
Technique. It's a hard technique. And, if we can, I think, we've already kind of spoken to it, but if we're being honest, we've all had our challenges with learning this technique and applying it. We've all had that patient where we've been stumped. We've all had that moment where like, well, maybe I'm not doing it as well as the instructor could have, or
Sure.
whoever. So
Right.
we've all had those moments of insecurity, but um, the whole 2% mindset, right? Outside your comfort zone is where greatness happens. This curriculum pushes you outside your comfort zone. It does it on day one of each course
Yeah.
for most of us.
And it's
Um,
not going to go away. I mean, that's part of the motivation. It's like, oof, I ran into someone I didn't help. I need to know more.
yeah,
Yeah.
right.
Hmm.
It's an endless journey of constant improvement, and again, you're just motivated by progress, just step after step after step, with either clinical efficiency or even just knowledge that you're acquiring along the way, understanding the human body better, and how it
Sure.
works, and then ultimately how to intervene.
Having appreciative patience doesn't hurt either.
Yeah,
Yeah,
yeah, that always helps.
that's right.
Well, thank you, Greg. I think you helped me answer, I think, a lot of questions for some of our students that are just starting the curriculum or early on in it. I think hearing from both of us is hopefully going to be very valuable for them and help them along the way. So I really appreciate you taking some time today to have a convo with me about it.
Yeah. Oh, my pleasure. Yeah, the feedback we get after the class is always incredible, just about what they get to learn, and how confident they feel that it's going to be applicable right away. So yeah, like we talked about, it's a great next class, and I look forward to seeing some great new students coming through.
Love it. All right, Greg. We'll talk to you soon.
Thanks, Cal. Cheers.
Goodbye.